This is a quiescent bone surface. There are osteocytes embedded in bone which secrete sclerostin. Sclerostin inhibits Wnt signaling in cells near the surface. Pre-osteoclasts circulate in the blood vessels. A sudden stress causes a microcrack to appear. The osteocytes near the crack undergo apoptosis. Osteocytes detect strain and secrete factors, such as growth factors, prostaglandins, and nitric oxide. The lining cells pull away from the bone matrix and form a canopy, which merges with the blood vessels. The actual steps here are not understood. Some of the canopy cells look like preosteoblasts. Stem cells appear to be near the blood vessels. Meanwhile, the stromal cells are now released from sclerostin inhibition and/or are exposed to other factors like interleukin-1. They generate preosteoblasts. Stromal cells also secrete macrophage colony-stimulating factor, which helps generate preosteoclasts. The preosteoblasts proliferate and also secrete more factors such as Wnt, interleukins, and bone morphogenic proteins. The preosteoblasts start to express rank L on their surfaces. Apoptotic osteocytes also express rank L. Preosteoclasts have rank receptors on their surfaces. The preosteoclasts enlarge and fuse into mature osteoclasts. The osteoclasts bind to bone matrix with integrins and secrete acid and cathepsin K to resorb the bone. Bone resorption at this spot can take about 2 weeks. Bone-derived growth factors IGF and TGF-beta are released. The TGF-beta causes the osteoclast to secrete Wnt. Eventually, the osteoclast undergoes apoptosis. The osteoclast lifespan is regulated by estrogen and other factors. Pre-osteoblasts mature into osteoblasts, which stop making rank L and secrete OPG. The OPG binds to rank L like a decoy receptor, which blocks activation of the pre-osteoclasts. Pre-osteoblasts proliferate and then mature into osteoblasts, which line the resorbed cavity. The osteoblasts secrete osteoid and then mineralize it to fill in the cavity in 3 to 4 months. The matrix also contains other proteins and growth factors such as IGF and TGF-beta. Some osteoblasts turn into osteocytes, some turn into lining cells, and the rest undergo apoptosis. Who knows what happens to the canopy? This is a guess. Meanwhile, the osteocytes have been re-establishing a network with each other and with the lining cells. The microdamage has been repaired. The new matrix will accumulate mineral and increase in density for about 3 years.